Hi, my name is Chase Nguyen, and this is a career in dentistry. Why I want to be a dentist. I chose the career path of a dentist because of many things, such as the work environment, flexible schedule, and the overall nature of dentistry. I like the clean and calm dentist offices that I hope one day I can work in. I like the short hours and flexibility of a dentist schedule, with some working only 4 days a week. Lastly, I like the type of work dentists do. They're able to help people with something that significantly affects their confidence. And I want to build long-term relationships with my patients as well, which is one thing that dentists can do. Education required. To become a dentist, first off, you need 4 years of undergraduate studies to get your bachelor's degree. And for me, that would be from 2025 to 2029. Dental students would major in a science-related field such as biology or pre-dentistry, which fulfills dentistry school prerequisites. Next off is the dental admissions test, or DAT, which I would take in 2029. This is required for dental school admission. Students usually study for the DAT while in college. Next up is dental school, which takes 4 years. And for me, that would be from 2029 to 2033. This is where I will earn a Doctor of Dental Surgery, DDS, or a Doctor of Dental Medicine, DMD degree. The first 2 years focus on classroom education, and the last 2 years are more hands-on experience and training. Next up, after dental school, is licensing, which would take place in 2033. After dental school, I must pass a licensing exam to practice. This varies by state, but most likely includes a written and clinical exam. As for residency, none is needed. So in total, it would be 8 years to become a dentist, and for me, it would be from 2025 to 2033. The colleges to attend for me, I plan to attend UCI for my undergraduate studies, and after I pass my DAT, attend the University of the Pacific School of Dentistry. I want to go to UCI because it has strong science programs, great pre-dental resources, close to dental schools, and it's affordable. As for UOP, it offers an accelerated 3-year dentistry program and has a strong reputation for its clinical training. This way, I could join the workforce as a dentist 1 year earlier. So to prepare for my career as a dentist, I have to gain hands-on experience through job shadowing, internships, or volunteering. This is because many dental schools require students to have experience. It provides real-world experience and skills training. I would also join dental clubs at UCI and connect with professionals. This would help me learn more about dental school, receive mentorship, possible internship and shadowing opportunities, and I can connect with other pre-dental students. What's after undergrad? As discussed earlier, after undergrad, I would have to go to dental school, which would require a bachelor's degree I would get at UCI, a GPA of 3.5 or above while at UCI, a DAT score of more than 20 out of 30, and letters of recommendation. After dental school, I'll have to pass licensing exams. One of the licensing exams is the Integrated National Board Dental Examination, or the INBDE. I also have to pass Clinical Board and Jurisprudence exam, which is state specific, but in California, both are required. Specifics of dentistry. Dentistry is the branch of healthcare that focuses on the diagnosis, prevention, and treatment of oral health conditions. The starting salary for a dentist in California is about $187,500 a year, or $90 an hour. The average salary of a dentist in California is about $234,200 a year, or $112 per hour. So, the day-to-day life of a dentist. For Dr. Hete, the dentist that I shadowed, his weekly schedule, he works from Monday to Thursday from 8 a.m. to 4 p.m. So from 8 to 8:30 a.m., he preps equipment and reviews his schedule. From 8:30 to 10 a.m., he does cosmetic consultations with his patients and does more prep work, which includes veneers, crowns, and Invisalign. From 10:30 to 12 p.m., it is more general dentistry. This includes routine exams, cleaning, and x-rays. From 12 to 1 p.m., he has lunch and he reviews patients and cases. From 1 to 2:30 p.m., he does cosmetic procedures such as whitening, crowns, and veneers and bridges. From 2:30 to 3:45 p.m., he does post-op cosmetic care. He also visits hygienists and helps around the office. Lastly, from 3:35 to 4 p.m., he wraps up and documents and prepares for the next day. Summary of my job shadow. I shadow dentist Dr. Chris Hate at the Coyote Hills Family Dentistry. His clinic is a specialized clinic where they specialize in cosmetics and restorations. During my jaw shadowing time, I watched as he consulted his patients on things like replacements and full teeth row replacements. He explained the procedures, answered questions, and helped them choose their best treatment plans. In between his major procedures, he would often visit his hygienists and their patients and help with the cleaning and checking up on patients. My favorite memory while there was when he had to replace a whole set of teeth for a recovering drug addict. He had a bridge of printed teeth with a replica of the gums to fit the patient's mouth and even the color of his teeth and gums. It was really amazing to see that him and his team were able to model and create a replacement for the whole front row. What I learned. During my time shadowing Dr. Chris Hate at Coyote Hills Family Dentistry, I learned more about the daily life of a dentist, including their procedures, relationships to their patients, and what they specialized in. Their daily life consisted on consulting, visiting, operating, and cleaning patients. Dr. Hate personally knew almost all of his patients, with the exception of patients who were at the clinic for the first time. The most important lesson I learned, though, was to love what you are doing. Dr. Hate made this very clear to me, and one of the reasons he was so successful as a dentist was because he loved what he was doing. These are some of my pictures from my time job shadowing. The man in black right here, and right here, this is Dr. Chris Hate, the man I was job shadowing, and right now he's working on some patients and operating on them. And these are some more pictures. Right here, this white cart. This is their 3D imaging technology where they can get a better view of the patient's teeth and gums. And the picture on the right, this is their lab where they can sometimes make crowns and bridges themselves. The, so the cost to become a dentist. First off, 4 years of undergraduate education at UCI would cost $155,400. And then the 3 year dental school at the UOP would cost $525,000. Licensing and examination fees, including the DAT and post-licensing exams after dental school, would cost $1,540. So the total cost to become a dentist would be $681,940. So my plan to pay off a total of $681,940. I plan to take out a loan with a fixed interest of 7%. I plan to pay off all my debt with a 10-year repayment plan. My salary as a dentist being $13,625 a month, my loan payments being $7,920 a month, my leftover income after payment to take care of stuff like rent and personal expenses would be $5,705 a month. Since I graduate 1 year earlier, I will be able to enter the workforce as a dentist earlier and get done with my payments faster. Over 10 years, I will pay $268,200 in interest, plus the original $681,940, which will amount to around $950,150. How did the taking of the biomed pathway help me in choosing my decision in pursuing dentistry as a career? Ever since I joined the biomedical pathway my freshman year, I was able to explore the medical field early, giving me experience in the different fields of biomedical sciences. These experiences, especially as a freshman and sophomore, solidified my interest in healthcare. These experiences, such as hands-on labs, made me realize that I like hands-on work. Exploring the human body also sparked an interest in dentistry, as the teeth and jaw were a major part of my curriculum. Finding my passion in dentistry wouldn't have been possible if I had never joined the biomedical pathway. Joining the biomedical pathway opened my eyes to so many different career options, not just dentistry. And the most memorable lesson I learned in biomed, don't be weak. And my advice for freshmen would be to don't stress out, don't force yourself to choose a specific career so early. You still have so much time to decide, even after high school. Join lots of different clubs or groups to discover your passion. And lastly, get your driver's license as early as possible. Trust me. And these are my sources. Thank you.